Thank you for staying with us as we get to this end, the health end of our discussion this morning. We're talking about COVID-19, especially in respect of the Delta variant. And we have joining the conversation Professor John Japong, Vice Chancellor, University of Health and Allied Sciences. He joins the conversation. He is also chairman of the FDA Joint Committee on COVID-19 vaccine safety. Prof, a very good morning to you. Thank you for your patience and thank you for joining the conversation. Prof, if you could unmute so we can hear you, we'd be grateful. So we're going to wait for Prof as he unmutes so we can actually connect with him and find out what he has to share on the latest dynamics when it comes to this Delta or Indian variant of COVID-19. Mind you, we have had the Alpha or the UK variant, we've had Beta, Gamma, and now Delta, which is the one that is wreaking a lot of havoc across the world. In the UK, it is now the dominant variant. In the US, at least 10% of the latest cases are of the Delta variant. Prof, can you hear me now, sir? So we shall try to reconnect with Prof, but the latest dynamics not looking too good when it comes to the Delta variant, which is wreaking havoc, like I said, in India, in the UK, in the US, and in different parts of the world. Recently, we were told by Professor Awandari of WACBIF that it is now in our country. The problem has to do with the numbers and determining how many people exactly have contracted that strain of the virus. It also happens to be a lot more contagious, and in terms of hospitalization, if you were to fall to it, it could be very quickly deadly. Prof, a very good morning to you once more.
Good morning, and thank you for having me. Can you hear me now?
I can hear you loud and clear. So right before you reconnected, I was talking about the fact that we've had the Alpha variant from the UK, we've had Beta, Gamma, and now Delta, which is causing quite a number of problems across the world. But break it down for us. What is the core difference with the Delta variant? How does it manifest, Prof?
Well, first of all, I am not a microbiologist or a virologist, so I would not be getting into those details. But suffice it to say that there is pressure on the virus, and once there is pressure, there occurs some form of changes, because the virus also needs the numbering alpha, beta, gamma, and delta basically shows the new strains that are coming up. So we had the alpha, which I think was in the UK, and then the beta, which was the so-called South African variant, and then now the Delta from India. And even yesterday I heard about the Delta Plus, which is a newer variant of what is happening in India. So once there is pressure, the virus would also adapt to survive. So it's a survival mechanism. In terms of the presentation of the disease, it's basically the same kind of clinical signs and symptoms that we are talking about, but it's been suggested that the Delta is a little more transmissible. So the rate at which it infects people is much higher than the earlier strains.
So you may not be an immunologist, Prof, but...
Can you hear me?
Yes, I can hear you. Can you hear me? Can you hear me, Prof?
Yes, I can hear you. Yeah.
Great. Now, you may not be an immunologist,
but I can hear you.
Right. So I just want to find out from you how much more you know about, what safety the vaccines we're taking so far have as far as this new strain is concerned. We've been told by medical research teams, though not peer reviewed yet in India, that the antibodies that are generated when you take the AstraZeneca vaccine are not as effective against the Delta strain, while some others are also saying that, well, it is enough to prevent severe cases of the virus and even hospitalization. How much can you share with us on that front, as far as you know it?
Well, I think the most comprehensive data that is available is from Public Health England, which published some results from some studies they've been doing last week. In that report, there were about 14,000 or so cases that they followed up. And it was very clear that for those who have received 2 doses of the Pfizer vaccine, there was basically a 96% protection, if I may put it that way, compared to a 92% protection for those who had received the AstraZeneca vaccine. And by public health standards, these are very excellent results. So I am not sure why there is this furore around about. So I think that.
But Prof, just to interject, if you can hear me, Prof. So you're speaking of the Pfizer vaccine, but I'm talking about the AstraZeneca vaccine, which both of us, or at least most of us, have had 2 shots of right here in Ghana. People are talking about AstraZeneca and Sputnik V and how effective this may be. You're mentioning Pfizer, which has shown quite a bit of efficiency or effectiveness against the virus. We would get to that, but my point has to do with some of the vaccines that are already in the system that have been taken and maybe their potency against the Delta strain.
I think if you were patient enough, you would have heard what I said, that the Pfizer gives 96% protection if you have had 2 doses, whereas the AstraZeneca has been shown to give 92%. 96 and 92% protection from any immunization program is very excellent by public health standards. So the important thing is to ensure that we get vaccinated as a country, and until we get vaccinated, then we need to keep to the protocols, because that is the key thing. There is a lot of information going around about herd immunity, which is very, very relevant. But once we have not reached that point yet, as public health people, what we need to do is to ensure that we keep to the protocols. As we speak now, per the data available, Ghana has about 1.2% of its population receiving the 2 doses, with a very maybe another 1.2% also haven't received 1 dose. Bottom line is that over 95% of our population have not received the vaccine. That, for me, not on the potency of the vaccine. The concern is to ensure that we get as many people as possible vaccinated. If you compare to the other developed countries, I mean, the UK and the US are ranging very high. I mean, I think the UK has almost 60% of its population haven't had 2 doses as at this morning. And another 20 or so percent haven't received a single dose. So protection comes from, till we get to that point, with the force of infection at the community level, then our 1 to 2% population who have been immunized will continue to face a lot of force of infection from the community. So the protection is not really there. Of course, they will get exposed to infection, but the severe disease is not likely to occur in those who have been vaccinated. Those who have not been vaccinated are at the highest risk. And therefore, my message is that we should continue to keep to the protocols, ensure that we wear the masks, we sanitize our hands and all our environments, and avoid all those kind of risky behaviors that went on around Christmas time and before, where there were so many parties, so many huge gatherings, campaigns were going on all over, large funerals. Gathering of huge populations is completely a risky thing to do at this time.
Now, let me find out from you, Prof. We've vaccinated less than 1 million. The last I checked, over 800,000 of our population, and you've broken it down, even those who have taken both jabs of AstraZeneca. But when you put that side by side, you have also indicated those who have got vaccinated in the likes of the UK and the US. But in the UK, the Delta strain is now the dominant strain. In the US, 10% of new cases are on the back of the Delta strain. So how effective would you say our vaccination drive so far would be in some measure to mitigate or contain the situation?
I want to re-emphasize that it is not the vaccine you receive per se, because for now, the vaccines that are on the market have all been shown to have some level of potency. And if our public health interventions were effective and was enough vaccines around the world, we wouldn't be having any problems with very skewed distribution of the vaccines, such that the haves have it all and the have-nots have almost nothing. And that, for me, is the problem. So whichever strain it is, another strain, and it will get another name, and may become the dominant strain in the protection. One of
So a bit of a technical challenge there. Prof, if you can hear me, we're going to try to reconnect with you shortly. But so far, of course, as far as we know, the Delta variant is on the prowl across the world. It is actually decimating populations, like I mentioned earlier. In the UK, it's now the dominant variant, and the National Health Service there is working to mitigate the situation. In the US, 10% of new cases are accounted for by the Delta variant. It's also popped up right here in Ghana, the Delta or the Indian variant, and how well we can contain it is what we're all looking at, especially as we have different dynamics to face. We don't even have vaccines available on the back of recent developments. We don't have AstraZeneca, we don't have Sputnik V, and now with some of what the researchers are bringing to the fore, we might need the likes of the Pfizer vaccine. If that be the case, and when Prof reconnects with us, I would want to find out from him what's the real scenario, how things could play out when it comes to acquiring the Pfizer vaccine, in case there is some redundancy when it comes to the AstraZeneca vaccine that all of us have taken. So we'll try to reconnect and get some concerns. Prof, welcome back. Thank you for joining us again.
Hello, can you hear me now?
I can hear you.
Right. I heard your last bit. I think it is not an issue of acquiring a new kind of vaccine. And I think we need to get this very clear. It is not the 96% versus the 92%, which is the most important thing. Talking about acquiring this Pfizer vaccine, even the cold chain system to vaccine does not exist in our country. Pfizer vaccines have to be kept at an ultra low temperature of minus 80 degrees. We do not have that kind of infrastructure. Of course, if some of that should arrive in this country, probably it could be used in some big cities and teaching hospitals where there is backup services. The important thing is having enough vaccine, whichever type of vaccine it is, to vaccinate the population to achieve what we've been referring to as the herd immunity. Beyond that, we need to keep to the protocols to ensure that we are protected. As to the...
Hello, Prof. Are you still with us?
Variants arriving in the state in some years. I'm sorry, this interview is not going too well. Is it better now?
Yes, please go ahead.
Yes. So the virus has been detected in samples that were taken at the airport, which means that...
So Prof, with all apologies, this is what we're going to do. The Zoom connection doesn't seem to be too good, so we're going to reconnect with you, if you can hear me, via the phone lines. I suppose that should be better where you are. So we're going to try to do that shortly. Professor, explaining to us a short while ago about the realities of acquiring the Pfizer vaccine. That's something I was actually going to get into with him when it comes to storage, when it even comes to cost of that vaccine. But he's already started on that front. When he returns, we'll also talk about the other side of the question I posed when it comes to AstraZeneca. Yes, indeed, some have given it, effectiveness or potency of 92%, but not all. That is not across the board. And there are others who also say that even in respect of the AstraZeneca vaccine, when it comes to potency against the Delta, that potency level or effectiveness is reduced by even more. And that it may be effective when it comes to serious cases and hospitalization, but generally, for those who may not even have got the vaccine, that could pose quite a threat. As and when Prof connects with us, we shall get into some of those. Prof, welcome back. So just a quick point. I wanted to make on the back of some of what you've been saying. The potency level of AstraZeneca, 92%, well, there are some other reports that don't give it that high a potency. And especially on the back, the relevant bit here is that when it comes to the Delta variant, the effectiveness is not the same. I've read reports that put it at 70-something%. And some say that in serious cases, and in cases of hospitalization, then it might, play a purpose. But in other cases, especially for people who have not been vaccinated at all, it may not be that helpful. So what exactly are the dynamics that you can share with us on the back of that?
I think there is a lot of reports out there which are being misread or misrepresented. The 70% that you refer to, as far as I know, is for the single dose. But we are talking about a double dose. So if you have a single dose, like I have had, and I haven't had opportunity to get the second dose, then my level of protection is much lower compared to you who have had the two doses. So I think we need to interpret the data that we see out there very cautious. I think as far as the vaccines are concerned, what is on the market for now, which has been given emergency use authorization by the World Health Organization, are all working within the same or relatively statistically insignificant range. And if you are managing a public health system, the important thing is to get the vaccine that you can deploy effectively. So, I mean, I raised the issue of a cold chain for the ultra low temperature kind of vaccines that you're referring to. I don't think personally, from data that I have seen, that getting the Pfizer vaccine is going to make any change whatsoever in our public health system here. The important thing is to have enough vaccines, which have all been tested to have the potency that we are looking at. And in public health delivery of our intervention, once you have a product that is beyond 80% or so potency, I mean, you are good to go. The important thing is to ensure that you have a good delivery system to ensure that as many of your population, I mean, as many of your inhabitants receive the vaccine. So the focus should be on acquiring the vaccine and delivering it effectively. I don't think we should spend time and energy on changing course on which vaccine to go for. Of course, if there is a donation of the Pfizer vaccine, we should receive it and deliver it through systems where you can have an ultra low temperature to be able to deliver the vaccine.
Right. Now, Prof, you're a member of the FDA Joint Committee on COVID-19 vaccine safety. What else would you say, I mean, as a member of that committee, that we ought to be doing, especially from the safety end, to ensure that we can weather the storm as far as Delta has hit? You have served with that committee. What can you share?
Oh, okay, right. I mean, I think we need to clarify a few things. The FDA runs on technical advice, and they have a couple of committees which advise them on what to do. My original job in FDA, I mean, if it is anything of a job, is to chair the clinical trial committee, where we review and approve all clinical trials that are done in the country. There are committees also that look at vaccines, drugs, and even food products and things like that. So when this pandemic broke, FDA decided to form a joint committee made up of the chairs of the various committees and another member. So each committee brought 2 members to form what we call the joint committee, which you are referring to. And what we do is to assess a couple of things. We look at AEFIs. AEFIs are acute effects, adverse events following immunization. And if there are any reported deaths, we do what we call the causality assessment. So we want to assess whether the deaths that has been reported could be attributed to the vaccine, and also to try and see if there are any adverse events of importance that we need to look at and raise the red flags so that we are able to avoid any unforeseen things. So that is what we do on that committee. So all the AEFIs that have been reported through the FDA portals and through interviews and all that are compiled and assessed, and we meet every other week to assess these things. So as far as the Delta strain is concerned, we are not looking specifically at Delta strain or Gamma strain or Beta strain or whatever. But it is important for us to note that once the Delta strain has been detected at the airport, it is only a matter of time that we may find it in our community. And if it gets into our community, and given the experience from other countries, how it's been ravaging all over the place, we need to alert our public health system to ensure that the protocols are maintained. Because it is the same thing, whether it is Delta, Gamma, Beta, or Alpha. It is nothing else that we can do except to ensure that the protocols are enforced.
Okay.
And I want to emphasize this because even in a country where less than 2% of our population have been vaccinated, that is our best bet. In fact, that is our only bet that we have. You know, in the UK and other places where they have vaccinated a much, much bigger percentage of their population, the force of infection is much lower. And even that place, they are having challenges with the Delta strain. So can you imagine what would happen if the Delta strain were to get into our community and begin to spread? It will spread like wildfire. So we need to, reinforce our surveillance system, particularly at the airport, and then also at the community level, to ensure that if there are any cases that have come into the community, we use our surveillance system to identify and put in place the appropriate public health measures to avert any wild spread that has happened in other countries.
Prof, thank you so much for joining us for the conversation. We're very grateful for your time. That is Professor John Japong, Vice Chancellor, University for Health and Allied Sciences, Chairman of the FDA Joint Committee on the COVID-19 Vaccine Safety. We'll take a breather. When we come back, we wrap the AM show.